Good evening to all my students. Today we're going to discuss this topic regarding the anatomy of the blood vessel. This topic is very important as it will be used during your clinical posting. So you have to concentrate throughout this lecture. First of all, I would like to introduce to you what is the structure of the blood vessel. What is the blood vessel actually? So the blood vessel form a closed tubular network. It's like a piping system in our body. It's a closed tubular network. It's not an open system network, but it's a closed tubular network. And what is the function of this blood vessel? It allow or permit the blood flow from the heart. So the blood will flow from the heart, and then it will reach to the all living cell of the body, and then later this blood will return back to the heart. So it's like a closed cycle system in our body. Okay, it's a piping, it's closed piping system in our body. So the blood will leave the heart. It passes through a small vessel of progressively smaller diameter. Mean that initially the blood will passing through the larger diameter of the blood vessel, and then it will pass later. You're going to pass through the smaller diameter of the blood vessel. For example, here, if you see from this arrow, this is the direction of the blood flow from the arteries to the arteriole and finally to the capillary. So the capillary is the smallest blood vessel. By definition, the capillary is a microscopic vessel that join the arterial floor to the venous floor. If you see from this picture, you can see that this is the blood vessel, this is the artery, and this is the vein. So the connector or the capillary is located in between this larger vessel. So it connects between the artery and also the vein. So, and then the blood returning to the heart will passes through the capillary, and then later it passes through the larger vessel. Okay, so blood that return to the heart will be passing through the smaller diameter vessel first, and then later it will passing through a larger diameter of the blood vessel. If you see from this picture, from this arrow, you can see that this is the movement of the blood that return to the heart from the venule, which is the smallest blood vessel, a smaller blood vessel, and then it will return into the vein, which is the larger blood vessel. And wall of the arteries and vein is composed of 3 layers or tunics. And the other term for the layers is tunic. Tunics means layer. So we have the tunica externa, or the other name for this tunica externa is tunica adventitia. And we also have tunica media. This is the middle layer, and the innermost layer is the tunica interna. So if you see from this cut section of the vessel, so we have here the outermost layer is tunica externa. In the middle, we have the tunica media, and the innermost layer is the tunica interna or tunica tunica interna. Yeah, that is the innermost layer. Okay, so we're going to explore these 3 layers. Okay, the outermost layer, the middle layer, and also the inner layer. As I have mentioned earlier, the tunica externa or tunica adventitia is the outermost layer. Okay, if you see from this picture, the cross section, whenever you cut the blood vessel, so you can see the cross section of blood vessel. So the outermost layer here is the tunica externa. It is the outermost layer, and it is composed of the loose connective tissue. Okay, the connective tissue that loose. Okay, and then in the middle here we have the tunica media, which is located in the middle. Okay, and here the tunica media it is comprises of smooth muscle layer and also the variable amount of elastic fiber in between the smooth muscle fiber. And then in the middle here, in the yellow color line here, okay, it represents the tunica interna, which is the innermost layer. And this layer it is composed of the simple squamous epithelium. Simple means a single layer. Squamous means a flattened type of cell that line this innermost layer, the tunica intima. Here we also have the elastic fiber, which composed of the elastin. Okay, now we're going to discuss on the definition of the endothelium. So what is the endothelium? So based on this picture, you can see here, this is the endothelial layer. So the endothelium is a layer of a simple squamous epithelium. Simple means only a single layer of cell, and this cell is a flattened in shape, or flattened in shape, squamous in shape. So usually this type of this endothelium, it line the inner wall of the all blood vessel. Okay. Okay. So you can see here we have the artery on the left hand side and the vein on the right hand side. So this is the cut section of the artery and also the vein. So from this cut section, so you can see the three layers that form the blood vessel. So the innermost layer is the tunica intima, followed by the middle layer, which is the tunica media, and the outermost layer is the tunica externa. So the connector, the vessel that connect between the vein and also the artery is a capillary network. Okay, the thing that you have to remember here is this vessel, either it's a bigger vessel or smaller vessel, they have a special characteristic. So we're going to discuss on the artery first. For each of the type of the artery that we have, start to discuss on the large artery. What are the characteristics of the large artery if we compare to the other remaining artery? So for the large artery, so if you see here from this picture, this is the large artery, okay, on the right hand side. The tunica media, it has numerous layers. It has a lot of layer of elastic fiber that present in between the smooth muscle cell. It's like if you try to imagine the cake layer, it's quite similar to the layer of a cake. Okay, but here is a tunica media. It is composed of the numerous layers of elastic fiber. In between there, we have a smooth muscle cell. So this large artery, it will expand. Okay, it will expand, okay, increase in diameter when the pressure of the blood vessel rises due to the ventricular contraction. When the ventricle contract during the systolic phase. Okay, and this large artery will later return back to the normal size whenever the blood pressure falls during the ventricular relaxation, which is the diastolic phase. So this is the characteristic of the large artery. Now we're going to proceed with the small artery and also the arteriole. Compared to the large artery, the small arteries and arteriole, it has less elastic than larger arteries. Just now I mentioned earlier that the larger artery, okay, it can expand, but here it is the small arteries and arteriole, it less elastic compared to the large artery, and it has a thicker layer of smooth muscle in proportion to their diameter. So most of the component of the middle tunica media, it is a smooth muscle layer. And it also has a narrow lumen, definitely narrow lumen compared to the large artery. Okay, this small artery, it provides the greatest resistance to blood flow through the arterial system. So now we're going to proceed with the capillary, which is the smallest blood vessel that we have in our body. Okay, it is the narrowest of blood vessel, and the size is about 7 to 10 micrometer in diameter. It's very small. And what is the function of this capillary? It serves as a functional unit, okay, a functional unit of the circulatory system. Okay, here in the capillary, there is exchange of gases happen, okay, between the oxygen and also carbon dioxide. Not only exchange of gases happen here, also the exchange of nutrients happen in the capillary, and waste exchange of nutrient and also the waste product, okay, between the blood and also the tissue, okay, cross their wall. That's why the capillary, its wall is very thin, okay, and the amount of the blood flowing through this particular capillary bed is determined by the precapillary sphincter muscles. So this is the descriptions about the capillary. Okay, there are three types of capillary that you have to know. The first one is continuous capillary. The second one is a fenestrated capillary, and the third one is discontinuous capillary. Okay, now we're going to discuss one by one of each of type of capillary. Okay, for the continuous capillary, if you see from this picture, this is a continuous capillary. From the name, we know that it is continuous. So adjacent endothelial cells are tightly joined together. So there are no gap, no opening, no gap in between the cell. Okay, this is the endothelial cell. Okay, this is the nucleus of endothelial cell. So there is a no gap in between the cell. So where you can find this continuous capillary, it can be found in the muscles, in the lung, adipose tissue, and also in the central nervous system. Okay, and so you can see from this picture, you can see this continuous capillary, it has a tight junction. Okay, now we're going to proceed with the fenestrated capillary. For the fenestrated capillary, from the name, we know it's they have a small horn, fenestration. Okay, usually it can be found in the kidney, in the endocrine gland, and also in the intestine. So what is the characteristic of the fenestrated capillary? It is characterized by the wide intercellular pore. There is a small opening. Okay, the pore, intercellular pore. You can see here. This is the intercellular pore. Okay, and this pore is covered by a layer of mucoprotein, and this layer of mucoprotein, it serves as a diaphragm. Okay, now we're going to proceed with the third type of capillary, which is the discontinuous capillary. From the name itself, you know that it is discontinuous. Okay, so mean that it's a large gap, okay, in between the endothelial cell. This type of capillary, the discontinuous type of capillary, can be found in the bone marrow, in the liver, and also in the spleen. Okay, if you see from this picture, there is a space between the endothelial cell, and the space is very great, very big, very huge. This capillary look like cavity or sinusoid in the organ. So that is regarding the capillary. Now we're going to proceed with the vein. So what is the vein? The vein is the vessel that carry the blood from the capillary. Okay, this is the vein. Okay, we have a different size of the vein, different type of vein. So it carry the blood from the capillary back to the heart. So that is the function of the vein. Okay, it return the blood, okay, from the capillary to the heart. So blood is delivered from the vena into a progressively larger vessel. Okay, from the smaller vessel into the larger vessel. From here, this is the capillary. So from the smaller vessel to the larger vessel. Okay, the direction should be like this. Okay. Okay. And the average pressure in the vein is about 2 millimeter mercury. Okay, and the average arterial pressure is 100 millimeter mercury. Definitely, the arterial pressure is higher compared to the venous pressure. Okay, so because of this lower pressure, low venous pressure is not enough to return the blood. It's insufficient to return the blood to the heart. Okay, particularly from the lower limb, because the lower limb is actually located lower at the lower part of our body. It's quite far from our heart. Okay, so there is a gravity. It is influenced by the gravity. Okay, so how to and what is the solution to this problem? So the vein that passes between the skeletal muscle groups, okay, will be squeezed whenever this skeletal muscle contracting. Okay, so this skeletal muscle, it acts as a skeletal muscle pump. Okay, and then when one-way flow of blood also is ensured by the presence of the venous valve. Okay, in the artery, we don't have a valve, but here we have the valve, venous valve, to ensure that it only happen in one direction. Okay, flow happen in one direction. Okay, there is no backflow happen. So that is the importance of the venous valve. Okay, you can see here, this is the artery, this is the vein. Whenever you cut the vein like this, so you can see inside inside the lumen we have the valve. Okay, but here the artery we don't have the valve. Okay, now we're going to discuss on the principal artery that we have in the body. Okay, later we're going to discuss on the vein. Okay, we're going to proceed with the larger artery first, which is the aorta. Okay, for the aorta, so if you see here, this is the aorta. This is the heart. Okay, so the aorta, it ascends, it going up from the left ventricle to a position just above the heart. You can see it is located above the heart here, and it arches to the left, move to the left, okay, and then descend through the thorax, and later going down here to the abdomen. So the branches of this aorta, it carry the oxygenated blood to the cell of the body. That's why the color of this vessel is reddish in color. It represents that this artery, it contains a oxygenated blood. For the ascending aorta, okay, for the aorta, it is divided into the several parts. Okay, the first part here, the ascending aorta. Okay, it is a systemic vessel that ascend from the left. Okay, from the left of the from the left ventricle, from the ascend from the left ventricle of the heart. Okay, the ascending aorta, it ascend, it going up. Okay, up from the left ventricle of the heart. The branches that arises from the ascending aorta, we have only two branches that arises from the ascending portion of aorta. We have the right and left coronary artery. And this right and left coronary artery is very important artery in our body because it supplies to the myocardium of the heart. Okay, the coronary artery. We have right and also the left branches. And then I'm going, now I'm going to proceed with the aortic arch. Okay, the arch, the aorta will be arch to the left. Okay, and toward the back or toward the posteriorly over the pulmonary artery. If you see below the arch, aortic arch, we have the pulmonary artery. Okay, so it arch above the pulmonary artery. There are three branches that arises from the aortic arch. We have the brachiocephalic artery, okay, the first branches, and then followed by the left common carotid artery, and the third branches we have the left subclavian artery. Okay, these are the three branches that arises from the aortic arch. Okay, that you have to remember. Okay, now we're going to discuss one by one of each branches that arises from the aortic arch. Okay, we start to discuss on the brachiocephalic trunk. Okay, brachiocephalic artery or brachiocephalic trunk, same thing. Okay, if you see here, this is the brachiocephalic trunk or brachiocephalic artery. It is a first vessel that to be branched from the aortic arch. It's supplied to the structure of the shoulder region, upper extremity, okay, and also head, and also on the right side of the body. Okay, on the right side, it's mainly on the right side. Okay, supply blood to the structure of the shoulder, upper extremity, and the head on the right side of the body. So the brachiocephalic trunk, it rising superiorly through the mediastinum to a point near to the junction of the sternum and the right clavicle. Okay, here you can see here, this is the brachiocephalic trunk. Later, this brachiocephalic trunk will branches into a right subclavian artery. This is the right subclavian artery. Okay, this is the right common carotid artery. So I mean there are two branches of the artery that arises from the brachiocephalic trunk. Okay, we have the right common carotid artery and also the right subclavian artery. For the right common carotid artery, it extends, it going up, okay, extend to the right side of the neck, okay, and also to the head. Okay, for the subclavian artery, it carry blood to the right shoulder and also the upper extremity. Okay. For the left common carotid artery, okay, this is the second branch that rises from aortic arch. Okay, if you see here, this is the left common carotid artery, the second branch that arises from aortic arch. It transports blood to the left side of the neck and also the head. The right side of the neck and also head, the blood is carried by the blood is carried by the right common carotid artery. For the left side of the neck and also the head is carried by the left common carotid artery, and the left common carotid artery is a second branches of the aortic arch. Okay, and then the left subclavian artery, if you see here, this is the left subclavian artery. It's supplied to the left shoulder and also upper extremity. Okay, Now we're going to discuss on the artery of the neck and also the head. Okay, the common carotid artery. Okay, if you follow the course of this artery, here this is the example of the on the right side, right common carotid artery. The common carotid artery will course upward, is going upward in the neck along the lateral side of the trachea. Each common carotid artery will further branches. Okay, it will further divided into a internal carotid artery. If you see here, this is the internal carotid artery, and we have the external carotid artery. Okay, and the external carotid artery. Okay, these branches actually happen below the slightly below the angle of the mandible. Okay, at the base of the internal carotid artery, okay, there is a slightly dilatation that called this dilatation is known as a carotid sinus. Okay, if you see here at the base of the internal carotid artery, we have a slightly dilated area, and this part is known as a carotid sinus. Okay, what is the importance of this carotid sinus? If you see here, this is the carotid sinus. It contains the baroreceptor that monitor the blood pressure. This baroreceptor is very important. Okay, and not only carotid sinus, we also have the carotid body. If you see here, this is the carotid body. This carotid body is surround the carotid sinus. Okay, it's a small neurovascular organ. Okay, the carotid body, and this carotid body it contains the chemoreceptor. Okay, carotid sinus it contains the baroreceptor. The carotid body it contains the chemoreceptor, which respond to the chemical changes in the gut. Okay, now we're going to discuss on the blood supply to the brain. So the brain is supplied with the arterial blood that arrive through the 4 vessels. There are 4 vessels. Okay, these 4 vessels are the pair internal carotid artery. If you see here, we have 2 internal carotid artery. So this is actually the base of the part of the brain. Okay, base of the brain. Okay, so this is the enlarged picture of the base of the brain. So there are these 4 vessels. It form the circle of Willis. Okay, if you see here, the pair vessel here, we have the 2 internal carotid artery, and also the 2 vertebral artery. Okay, pair vertebral artery. So this vertebral artery, this artery will supply to the brain. The vessel will eventually unite on the inferior surface of the brain. If you see here, altogether, this vessel will unite on the inferior surface or the base part of the brain. Okay, in the area surrounding the pituitary gland, and it will form the circle of Willis. Okay, now we're going to discuss each of the pair of the vessel that I mentioned earlier. Start to discuss on the vertebral artery. If you see here, this is the vertebral artery. It arises from the subclavian artery, okay, at the base of the neck. Okay, this is the vertebral artery, and the vertebral artery it passes superiorly, and it passing through the opening. And this opening is known as a transverse foramina of the cervical vertebra, and then it enter through the scalp. Okay, it enter into the scalp through the foramen magnum. Okay, try to imagine here we have the scalp, and then within the cranium, inside the scalp, the vertebral artery will unite. Okay, 2 vertebral artery will unite together to form a basilar artery. Okay, at the level of bone. And then for the basilar artery, so if you see from this picture is actually just a continuation of the previous picture. So the basilar artery it ascends along the inferior surface of the brainstem, and this basilar artery will terminate to form two posterior cerebral artery. Okay, we have 2 posterior cerebral artery. Okay, posterior cerebral artery. And then we also have the posterior communicating artery here, posterior communicating artery. Okay, and posterior communicating artery is a branches that rises from the posterior cerebral artery. It rises from the posterior cerebral artery. And this posterior communicating artery, it participates in the formation of the circle of Willis or cerebral arterial circle that surround the pituitary gland. Okay. And then for the internal carotid artery, if you see here, we have the internal carotid artery. Okay. We also have two. This is the internal carotid artery. Okay. This is the common carotid artery. Okay. The common carotid artery will further divide into external carotid artery and also the internal carotid artery. So this internal carotid artery, it arises from the common carotid artery, and it will go up into the neck until it reaches the base of the scalp. Okay. And this internal carotid artery will enter into a carotid canal of the temporal bone. Okay. And then there are several branches that arises from the internal carotid artery once it's located on the inferior surface of the brain. Okay. These are the three more important branches that arises from the internal carotid artery. Okay. They are the ophthalmic artery. If you see from this picture, this is the ophthalmic artery. So the ophthalmic artery, it supply the eye and also the associated structure. And the other two artery that also arises from internal carotid artery is what? It's the middle cerebral artery and also the anterior cerebral artery. So there are three important branches of the artery that arises from the internal carotid artery. Okay, this is the internal carotid artery, and these two branches are middle cerebral artery and also the anterior cerebral artery. Okay, so this arterial system will connected to the posterior cerebral artery, okay, at the cerebral arterial circle of Willis. For the external carotid artery, just now we have discussed on the internal carotid artery. Now we're going to discuss on the external carotid artery. This is the external carotid artery. External carotid artery, it gives off several branches whenever it going up, extend upward along the side of the head and also the neck. And the name of the branches are determined by the area of the structure where it serves. Okay, these are the 6 branches that arises from external carotid artery. We have the superior thyroid artery. Okay, if you see here, this is the superior thyroid artery that supply to the muscle of hyoid region, larynx, vocal fold, and also the thyroid gland. And then we also have the ascending pharyngeal artery that supply to the pharyngeal area and also the various lymph node. The lingual artery, okay, if you see here, this is the lingual artery that supply to the tongue and also the sublingual gland. And we also have the facial artery. Okay, this is the facial artery. Okay, facial artery. Okay, and the facial artery, it traverses a notch on the inferior margin of the mandible. So this is the mandible. This is the inferior margin of the mandible, and it supplies to the pharyngeal area, to the palate, to the chin, to the lips, and also the nasal region. And then we also have the occipital artery, okay, that supply to the posterior portion of the scalp region, meninges over the brain, mastoid process, and certain posterior neck muscles. And then the final one is a posterior auricular artery that supply to the auricle of the ear and also the scalp over the auricle. So these are the 6 arteries that arises from the external carotid artery. If you see from this picture, this is the external carotid artery, and these are all the branches that arise from the external carotid artery. Okay, the external carotid artery will terminate at the level of mandibular condyle, and then it will form it will give another 2 branches. Okay, the terminal branches, which is the maxillary artery. The maxillary artery. This is the maxillary artery. And then we also have the superficial temporal artery. This is the terminal branches. Okay, the superficial temporal artery and also the maxillary artery. So altogether, we have 8 branches that arises from the external carotid artery, and the 2 terminal branches. Okay, the maxillary artery here will supply to the teeth, gum, muscle of mastication, nasal cavity, eyelid, and also the larynx. For the superficial temporal artery, okay, it supplies blood to the parietic gland and also the superficial structure of the side of the neck, of the head. Sorry. Okay, now we're going to proceed with the right subclavian artery. Okay, here, this is the right subclavian artery. The right subclavian artery, okay, it arises from the brachiocephalic trunk. Okay, for the left subclavian artery, it arises directly from the aortic arch. Okay, each subclavian artery, it passes laterally deep to the clavicle and carry blood toward the arm. Okay, now we're going to discuss on the artery of the shoulder and also the upper extremity. So from this picture, you can see here, okay, this is the subclavian, okay, the subclavian artery, okay. So this is the right subclavian artery. This is the left subclavian artery. Okay, so these are the branches that arises from the subclavian artery. We have the vertebral artery. If you see from this picture, we have the vertebral artery that arises from the subclavian artery. Not only vertebral artery, we also have the thyrocervical trunk that also arises from the subclavian artery. And this thyrocervical trunk, it's supplied to the thyroid gland, to the trachea, and also to the larynx. And then we also have the internal thoracic artery. You see here, this is the internal thoracic artery. Okay, it going down into the thoracic region to supply to the thoracic wall, thymus, and also the pericardium. And we also have the costal cervical trunk. That it's supplied to the upper intercostal muscle, posterior neck muscle, and spinal cord, and also the meninges. And then this subclavian artery, okay, this subclavian artery, okay, later it will become a axillary artery. If you see here, this is the subclavian artery. Later, it will form a axillary artery. Okay, the axillary artery is just a continuation of the subclavian artery. So this is subclavian artery. So and then axillary artery. Okay, and this axillary artery, it passes into the axillary region, okay, the armpit region, and axillary artery is a major artery of upper extremity between the outer border of the first rib. Okay, between the it's located between the between the outer border of the first rib. Okay, if you see here, okay, this is the first rib. Okay, outer border of the first rib. Okay, and lower border of the teres major. Okay, so this is the extension of this artery. Okay, and there are several small branches that arises from this axillary artery that you have to know. And this axillary artery is supplying blood to the tissue of the upper thorax and also the shoulder region. Okay, the brachial artery. Okay. So if you follow this artery, so you can see here we have the subclavian artery, and then we have the axillary artery, and then later this axillary artery will form a brachial artery. Okay, brachial artery. Brachial artery is a continuation of the axillary artery. It's just a continuation from a axillary artery. It courses on the medial side of the humerus. You can see here, it courses on the medial side of the humerus. This is the humerus, the humeral bone. Okay. There is a deep brachial artery branches from the brachial artery. If you see here, there is a deep brachial artery that branches from the brachial artery. And it curves, okay, posteriorly, okay, going backward, okay, near the radial nerve to supply the tricep brachii muscle. There is a deep brachial artery branches from the brachial artery. Okay, sorry. So I want to make a correction here. Okay, this is the deep brachial artery. Okay, because the picture quite small, so you have to carefully see need to carefully see the artery. Okay, there is a deep brachial artery that branches from the brachial artery and curves posteriorly near the radial nerve to supply to the tricep muscle. Okay, this is the part that I show you just now is a circumflex humeral artery. Okay, this is the correction that I want to make. Okay, and then we also have two additional branches from the brachial artery. We have the anterior and posterior humeral circumflex artery that I show you just now. Okay, it forms a continuous ring of vessel around the proximal portion of the humerus. So these are the two branches. Okay, there are three branches altogether. We have the deep brachial artery. We have the two additional branches here, anterior and posterior humeral circumflex arteries that form the circle. Okay, continuous ring of the vessel around the proximal portion of the humerus. Okay, so here you can see here from this picture, you can see the artery start from with the subclavian artery and then followed by the axillary artery form a brachial artery. So the brachial artery, okay, at the proximal to the cubital fossa, okay, it will be further branches into a radial artery and also the ulnar artery that supply to the blood of the forearm and portion of the hand and also the digit. Okay, for the radial artery, it courses down on the lateral side, the radial side of the arm, and it sends numerous small branches to the muscle of the forearm. Okay, this is the radial artery. And then you also have the anterior interosseous artery that extend deep within the antebrachium between the radial and also the ulnar artery. Okay, if you see from this picture, this is the anterior interosseous artery. Okay, it is located deep within the antebrachium between the radial and ulnar artery. We have the ulnar artery here, and then we also have the radial artery. So it is located in between. And then we also have the radial recurrent artery. This is the radial recurrent artery. Okay, the radial recurrent artery, it serves, okay, it's supplied to the region of the elbow. Okay, it is the first and the largest branch of the radial artery. Okay, for the ulnar artery, if you see here, this is the ulnar artery. It extends down on the medial or the ulnar side of the forearm. It gives off many smaller branches to the muscle on that side, on the medial side. Okay, and the initial large branch that arises from the ulnar artery is a ulnar recurrent artery. Okay, if you see here, we have the anterior and posterior. Okay, we have the anterior and also the posterior. Anterior posterior ulnar recurrent artery. This is the initial large branch of the ulnar artery. Okay, and this ulnar recurrent artery, it arises from the proximal portion near to the elbow. And at the wrist region, ulnar and radial artery, it anastomose. Okay, it anastomose. Okay, it continues to form a superficial and deep palmar arch. If you see from this picture, here we have the superficial palmar arch, and here we have the deep palmar arch. Okay, so it continues. Okay, at the deep palm, at the palm area. Okay, and then now we're going to proceed with the metacarpal arteries of the hand. Okay, so here, this is you can see here, this is the metacarpal artery. Metacarpal artery, it arises from the deep palmar arch. Okay, and how about the digital artery? It arises from the superficial palmar arch. Okay, the digital artery arises from the superficial palmar arch, but for the metacarpal artery, it arises from the deep palmar arch. Okay. Okay, now we're going to proceed with the thoracic aorta. So if you see from this picture, this is the thoracic aorta. Thoracic aorta is a continuation of the aortic arch. and it is located in the thoracic cavity. So it descends through the thoracic cavity toward the diaphragm, and it gives off branches to the organ and also the muscle in the thoracic region. So we have several branches that arise from the thoracic aorta. We have the pericardial artery that supply to the pericardium of the heart. We also have the bronchial artery, okay, that important for the systemic circulation to the lung. And we also have the esophageal artery that going to the esophagus, and as it passes through the mediastinum. And then we also have the segmental posterior intercostal artery that supply to the intercostal muscle and the structure of the wall of the thorax. And we also have the superior phrenic artery that supply to the blood, that supply blood to the diaphragm. So these are the artery or the branches that arises from the thoracic aorta. We have 1, 2, 3, 4, and 5 branches. How about the abdominal aorta? Okay. So the abdominal aorta is a segment of aorta, okay, that located between the diaphragm. Above here, we have the diaphragm up to the level of the fourth lumbar vertebra. So here, this is the abdominal aorta. Abdominal aorta, we further divided into right and left common iliac artery. If you see from this picture, we have the, on the right side, we have the right common iliac artery, and on the left side, we have the left common iliac artery. There is a branches that arises from, there are few number of branches that arises from the abdominal aorta. Okay, the first branch that arises from the abdominal aorta is a small inferior phrenic artery. If you see from this picture, this is the inferior phrenic artery, and this inferior phrenic artery is supplied to the diaphragm. Okay, try to imagine above here we have a diaphragm. So the what is special about the inferior phrenic artery? It is a first vessel, okay, to arise from the abdominal portion of the aorta. And then now we're going to proceed with the second branches that arises from the abdominal aorta, which is the celiac trunk or celiac artery. And celiac trunk or celiac artery is unpaired vessel, is a single vessel, unpaired vessel. It divides immediately into a three important vessel, which is the the left gastric artery going to the stomach, and then we have the splenic artery, and then we also have the common hepatic artery that going to the liver. Okay, so the celiac trunk we further divided into three. Okay, for the third branches that arises from the abdominal aorta is a superior mesenteric artery. It also an unpaired vessel, a single vessel. It arises at the anterior part of the abdominal aorta, just below the celiac trunk. So above the superior mesenteric artery, we have the celiac trunk. And this superior mesenteric artery, it supplies blood to the small intestine, except for a portion of duodenum, except cecum, except appendix, except ascending colon, and proximal 2/3 of the transverse colon. So this is the exception. So it supplies blood to the small intestine, except this part. Okay. And the other branches that arises from the abdominal aorta is a perirenal artery. If you see from this picture, this is the right renal artery and this is the left renal artery. This renal artery, it has two in number, okay, pair. It carries blood to the kidney. So we have the kidney, right kidney here, and this is the left kidney. And we also have the smaller suprarenal artery. Okay, if you see from this picture, we have the inferior suprarenal artery, we have the middle suprarenal artery, and suprarenal. Okay, suprarenal artery is located just above the renal artery. Okay, we also have the testicular artery in case of male, and the ovarian artery in female. Okay, this is the gonadal artery. Okay, or for male it's a testicular artery, for female it's ovarian artery. It's a small pair vessel. It's on two in number also. That arises from the abdominal aorta just below the renal artery. Okay, and this vessel is supplied to the gonads. And then we also have the inferior mesenteric artery. Okay, it's a last major branch of the abdominal aorta, and it is unpacked vessel. It's a single vessel that arises at the anterior part of the abdominal aorta, just below the arises just before the formation of the two common iliac artery. Before the abdominal aorta divide into two. Okay. It's supplied to the distal one-third of the transverse colon, descending colon, sigmoid colon, and also the rectum. Okay, we also have okay. We are still discussing on the branches of the abdominal aorta. We also have the several lumbar artery that branches posteriorly from the abdominal aorta throughout its length and serve the muscle and spinal cord in the lumbar region. And we also have the median sacral artery. If you see here, this is the median sacral artery. Okay, median sacral artery, which is the unpacked vessel, okay, that arises from the posterior terminal portions of the abdominal aorta, and it's supplied to the sacrum, okay, and also toward the coccyx. Okay, this is the to show you the lumbar artery. Okay, 1, 2, 3, 4, 4 branches, and on each side of the abdominal aorta. The lumbar. Okay, for the arteries of the pelvis and lower extremity, the abdominal aorta, just I mentioned earlier, it will terminate in the posterior pelvic area into two smaller artery. We have the right common iliac artery. We have the left common iliac artery. And this vessel is passed downward approximately 5 centimeters on the respective side, and further terminate later it will be further divided into two branches, which is the internal iliac artery. Okay, this is the internal iliac artery, and we also have the external iliac artery. Okay, from the common iliac artery, further branches into two: the internal iliac artery and then the external iliac artery. For the internal iliac artery, okay, it has extensive branches to supply. It has extensive branches to supply blood to the gluteal muscle and organ of the pelvic region. Okay, internal iliac artery supply to the blood to the gluteal muscle and also the organ that present inside the pelvic cavity. Okay, so wall of the pelvis is served by the iliolumbar artery and lateral sacral artery. We have the internal visceral organ of the pelvis that's served by the middle rectal artery. If you see here, this is the middle rectal artery that arises from the internal iliac artery. Okay, we have the other artery that also arises from the internal iliac artery. Like for example, here we have the superior, middle, and inferior vesicular artery. Okay, if you see from this picture, we have the inferior vesical artery, okay, that supply to the organ, internal visceral organ in the pelvic cavity. Okay, this picture just to show you the iliolumbar artery. Okay, and beside that, we also have the uterine artery. If you see from this picture, it's very small artery there. Okay, that this artery also arises from the internal iliac artery for the uterine artery. Okay, that supply to the uterus. And then we also have the vaginal artery. You see here, vaginal artery that supply to the vagina for the female. Okay, that supply to the female reproductive organ. Okay, the muscle of the buttock are served or supplied by the superior and inferior gluteal artery. If you see from this picture, you can see this is the superior gluteal artery, this is the inferior gluteal artery. Okay. Some of the upper medial thigh muscle are supplied by the obturator artery. You see from this picture, this is the obturator artery. Okay. Internal perineal artery of internal iliac artery serve musculature of the perineum and also the external genitalia. So these are all the branches of the artery that arises from the internal iliac artery. Okay, for the external iliac artery, okay, this is the external iliac artery. External iliac artery, it passes out of the pelvic cavity, going out from the pelvic cavity, passing deep to the inguinal ligament. So if you see here, we have one line here, the gray line here. This gray line is actually represent a inguinal ligament. So it passes deep to the inguinal ligament, and become this external iliac artery will become a femoral artery. Okay, there are two branches arises from the external iliac artery before it passes beneath this inguinal ligament. So we have the inferior epigastric artery. We have the deep circumflex iliac artery. Okay. Inferior epigastric artery, it passes superiorly, it going up to supply the skin and muscle of abdominal wall, and the deep circumflex iliac artery is a small branches that extend laterally to supply muscle attached to the iliac fossa. Okay. And then now we're going to proceed with the femoral artery. This femoral artery passes through the femoral triangle, okay, on the upper middle portion of the thigh, and there are several vessels, there are several arteries that arises from the femoral artery that serve the thigh region. The largest of these vessels is a deep femoral artery. Okay, if you see here, this is a deep femoral artery, deep artery of the thigh. Okay. Okay, this is the deep artery of the thigh. Okay, so it passes posteriorly to serve the hamstring muscle. And then we also have the lateral. Femoral circumflex artery, and also the medial. We also have the lateral femoral circumflex artery and also the medial circumflex femoral artery. Okay, they encircle the proximal end of the femur, and this artery itself muscle in this region. The femoral artery, okay, if you follow this artery, the femoral artery, okay, the femoral artery will become a popliteal artery. Okay, if you see here, at the back of the knee, it will become a popliteal artery. Here, from here, femoral artery at the back of the knee, it become a popliteal artery. Okay, on the opposite aspect of the knee. And the popliteal artery supply small branches to the knee region and divide into a anterior tibial and also the posterior tibial. So if you see from this picture, this popliteal artery will further divide into two branches. This is the anterior tibial artery and also the posterior tibial artery. And this vessel, it traverses the anterior and posterior aspect of the leg. Okay, it also provides blood to the muscle of this region and also to the foot. Okay, at the ankle region, this is the ankle region. Anterior tibial artery, if you see here, this is anterior tibial artery, will become a dorsal pedal artery that serve the ankle and also the dorsum super portion of the foot, and then contribute to the formation of the dorsal arch. Okay, the formation of the dorsal arch. And then for the posterior, this is the anterior tibial artery. Okay, anterior tibial artery. For the posterior tibial artery, okay, if you see here, this is the posterior tibial artery. Posterior tibial artery will give off a fibula or peroneal artery to serve the peroneal muscle of the leg. And at the ankle, posterior tibial artery will bifurcate, will further branches into a lateral and medial. If you see from this picture, this is lateral plantar artery. Okay, this is the medial plantar artery. And it's supplied to the sole of the foot region. Okay. Lateral plantar artery, this lateral plantar artery summates with the dorsal pedal artery. Okay, summates with the dorsal pedal artery to form a plantar arch. So this is the plantar arch. Okay, it's similar like arterial arrangement that we have in the palm or in the hand. Okay. The digital artery, so this is the digital artery. The digital artery arises from the plantar arch to supply to the toes. Okay, now we're going to proceed with the vein of the body. Just now we have discussed on the arterial system of the body. For the venous portion of the systemic circulation, so blood flow from the smaller vessel into a larger one. When from the all part of the body, okay, when from the all part of the body except the lung, it will converge into two major vessels that will empty into the right atrium. We have the superior vena cava and also the inferior vena cava. Okay, now we're going to discuss on the vein that draining the head and also the neck first. Okay, for the external jugular vein, okay, this is the external jugular vein. Okay, external jugular vein, it drains the blood from the scalp region, okay, from the scalp portion of the face and superficial neck region. Okay, the external jugular vein. This external jugular vein will empty into the right and left subclavian vein. Okay, it will empty into this subclavian vein. Okay, and the subclavian vein is just located just behind the clavicle. The internal jugular vein, so you can see here the largest size of the vein here. This is the internal jugular vein. This is the external. This is the internal. Internal jugular vein, it drains blood from the brain, okay, from the brain, okay, and also the meninges and deep portion of the face and also the neck. And this vein is larger in size and deeper, is located deeper compared to the external jugular vein. Okay, you try to compare between the external and also the internal jugular vein. There are this vein, it arises from the numerous cranial venous sinuses. Okay, this internal jugular vein will converge. Okay, this internal jugular vein will converge. The convergence of the internal jugular vein with the subclavian vein, the combination between the internal jugular vein and also the subclavian vein will form the brachiocephalic vein. So if you see here, this is a subclavian vein, it unites with the internal jugular vein to form the brachiocephalic vein. So we have the two brachiocephalic veins, right and left. Okay, two brachiocephalic veins will merge together to form a superior vena cava, which will drain into a right atrium of the heart. Okay, now we're going to proceed to discuss on the vein of the upper extremity. For the vein of the upper extremity, it has both superficial and deep venous drainage. Both radial and ulnar vein drain from the deep and superficial palmar arch of the hand. Okay, these are the things that you have to remember. Both radial vein and ulnar vein drain from the drain blood from the deep and superficial palmar arch of the hand. The radial vein and ulnar vein, if you see from this picture, this is the radial vein. This is the ulnar vein. Radial vein and ulnar vein will join, okay, to form a brachial vein. Okay, form the brachial vein. Okay, and this merge process or combination process happen at the cubital fossa. Okay, what is the main superficial vessel? Just now, I mentioned earlier, we have the superficial system and also deep system of the vein in the upper extremity. So the main superficial vessel of the upper extremity composed of basilic artery. So if you see here, basilic vein, sorry, this is the basilic vein, and we have the cephalic vein. Okay, this is the superficial vessel of the upper extremity. Basilic vein and cephalic. The basilic vein here will merge with the brachial vein, okay, to form a axillary vein. Okay, we have the axillary vein. Okay, but in this picture, it's not showing the brachial vein. But supposedly we have the brachial vein that unite with the cephalic vein, unite with the basilic vein. Sorry, unite with the basilic vein to form a axillary vein. For the cephalic vein, it drains a superficial portion of the hand and the forearm on the radial side, on the lateral side, on the lateral side. In the shoulder region, cephalic vein will join a axillary vein. Okay, you can see here in the shoulder region, the cephalic vein will join the axillary vein. Okay, the axillary vein unite with the internal jugular. The axillary vein will unite with the internal jugular vein to form the brachiocephalic vein. Okay, superficially in cubital fossa of the elbow, median cubital vein, okay, median cubital vein, okay, superficially in the cubital fossa of the elbow, the median cubital vein, it will ascend, going up from the cephalic vein, okay, going up, okay, from cephalic vein and connected with the basilic vein. Okay, this is the median cubital vein. Okay, it going up from the cephalic vein and connect with the basilic vein. This is the median cubital vein. Okay, now we're going to proceed with the vein of the thorax. For the vein of the thorax, okay, for the superior vena cava, it is formed by the union, okay, combination of the two brachiocephalic vein. We have the right brachiocephalic vein, and then we have the left brachiocephalic vein joined together to form a superior vena cava. This superior vena cava with with empty venous blood from the head, from the neck, and also the upper extremities that lead into the right atrium of the heart. So we have removed the heart here. Okay, supposedly we have the heart here, and this superior vena cava will enter into the right atrium of the heart. So this superior vena cava, there is a lacking of the valve that available in the superior vena cava. Okay, lack of valve. Okay, that is a special characteristic of the superior vena cava, lack of valve. And it also collects blood from the azygous system of the vein. If you see here, this is the azygous system of the vein. Okay, the azygous vein will drain into the superior vena cava. Okay, for the azygous vein, this is the azygous vein. It extends superiorly. Okay, it extends superiorly along the posterior abdominal and thoracic wall. Okay, azygous vein. Okay, it ascends through the mediastinum to join the superior vena cava. So this is the azygous vein. Okay, later it joined the superior vena cava. So the tributaries of the azygous vein include the extending lumbar vein, which drain the lumbar and sacral region, intercostal vein. So you can see here, this is the tributaries of the azygous vein. Okay, drain into the azygous vein, intercostal vein. And we also have the accessory hemiazygous vein. Okay, accessory hemiazygous, that vein that will drain into the azygous vein. Accessory hemiazygous and hemiazygous vein, which form the major tributaries to the left of the vertebral column. Azygous vein we have on the right side, but on the left side we have the hemiazygous vein and also the accessory hemiazygous vein. Okay, for the vein of the lower extremity, we also have the two systems, which is the deep system and also the superficial group of the vein. Superficial system and deep system. Okay, posterior and anterior tibial vein, okay, originate in the foot. Okay, if you see from this picture, this is the posterior tibial vein, this is the anterior tibial vein. It originates in the foot and goes upward, okay, and merge to form the popliteal vein. At the back there, we have the popliteal vein. Okay, popliteal vein receive blood from the knee region. Just above the knee, this vein will form a femoral vein, and femoral vein will in turn continue going up to the thigh region and receive blood from the deep femoral vein near the region. So if you see here, femoral vein going up, okay, and it receives the blood from the deep femoral vein, okay, near the groin area. Okay, this is the deep femoral vein. Okay, for the femoral vein, above the groin, it receives the blood from the great saphenous vein. Okay, so you can see here, above the groin, it receives blood from the great saphenous vein. The great saphenous vein has been cut here. And later, this femoral vein will become the external iliac vein. Okay, it will become the external iliac vein whenever it passes beneath the inguinal ligament. Here we have the inguinal ligament. Whenever it passes beneath the inguinal ligament, it becomes the external iliac vein. External iliac curve upward and merge with the internal iliac vein. So if you see here from this picture, we have the internal iliac vein. Okay, we have the external iliac vein. Later it will merge together, combine together, join together to form a common iliac vein. So here, example here, we have the right common iliac vein. And then we have two common iliac vein on the right side and also on the left side. And the right and left common iliac vein will join together, unite together, to form the inferior vena cava. So you have to understand the flow of this venous system. Okay. Okay, for the superficial vein of the lower limb are comprises of the small saphenous vein. If you see here, this is the small saphenous vein. Okay, small saphenous vein, and also the great saphenous vein. Okay, it's composed of great saphenous vein and also the small saphenous vein. This is the what we call the superficial vein of the lower extremity. For the small saphenous vein, okay, it arises from the lateral side of the foot, and it going up deep to the skin along the posterior aspect of the leg. Okay, and it will drain into a popliteal vein. Okay, this is the popliteal vein. Okay, on the posterior part of on the posterior aspect of the knee. For the great saphenous vein, it is the longest vessel in the body. So you can see here, it's very long. It originates from the medial side of the foot. Okay, medial side of the foot. It going up along the medial aspect of the leg and thigh, and it will empty into a femoral vein. Later, it will empty into a femoral vein. Okay, this is the great saphenous vein. Okay, for the inferior vena cava, so for inferior vena cava, it parallel with the abdominal aorta, side by side. This is the abdominal aorta, this is the inferior vena cava. It going up to the abdominal cavity to penetrate the diaphragm. Later, it will enter into a right atrium. Inferior vena cava is the largest in diameter of vessel in the body, and it is formed by the union, combination of two common iliac artery. So you can see here, this is the common iliac artery, two common iliac artery, right common iliac and the left common iliac artery. Okay, the blue color one. Okay, and it receives the tributaries from the vein that correspond in the name and position to the arteries previously described. And then we also have the four lumbar vein. If you see here, okay, we have the four lumbar vein, okay, first lumbar, second lumbar, third lumbar, and fourth lumbar vein that drain on the posterior abdominal wall, vertebral column, and also the spinal cord. Okay. We also have the renal vein that drain blood from the kidney, okay, and ureter into the inferior vena cava. Okay, this is the inferior vena cava. And we also have the testicular vein in case of male, okay, and also the and also the ovarian vein in case of female, okay, gonadal vein that drain into the inferior vena cava. And then we also have the right suprarenal vein that drains the right adrenal gland, and we also have the inferior phrenic vein. This is the inferior phrenic vein that receive blood from the inferior side of the diaphragm. So this is the diaphragm, okay, inferior side of the diaphragm. Okay, and it will empty into a inferior vena cava. Right and left hepatic vein. Okay, if you see here, this is the hepatic vein, and right and left hepatic vein originate from the capillary side of the liver will also empty into a inferior vena cava. Okay, inferior vena cava does not receive blood directly from the GI tract, gastrointestinal tract, and also it's not receive blood from the pancreas and also from the spleen. This is the important fact that we have to remember. Inferior vena cava does not receive blood directly from the GI tract, gastrointestinal tract, pancreas, and also spleen. Venous outflow from this organ is first passes through the capillary in the liver. So mean that venous outflow from this organ, the GI, from the gastrointestinal tract, pancreas, and also spleen, it need to passes through the capillary that we have in the liver. So this is the hepatic portal system. Okay. Okay, hepatic portal system is composed of veins that drain blood from the capillary in the intestine, in the pancreas, spleen, stomach, gallbladder into the capillary of the liver. Okay, and why this hepatic portal system is very important? Why it need to passing through the liver first? Hepatic portal system, the vein that drain all the gastrointestinal tract, because it absorbs the product of the digestion, okay, That's why it must passes through the liver first before it enter into the general circulation. Okay. So the right hepatic vein and the left hepatic vein, it drain venous blood from the liver. Okay, and this right and left hepatic vein will later empty into the inferior vena cava. Okay, that is the hepatic portal system that you need to know. Okay, the hepatic portal vein is a large vessel. Hepatic portal vein. This is the hepatic portal vein. Hepatic portal vein is the vein that drains the gastrointestinal tract. Okay, it's a large vessel that receives blood from the digestive organ. And you can see here, this is the digestive organ. It is formed by the union of the superior mesenteric vein. Okay, it is formed by the union of the superior mesenteric vein. Okay, this is the superior mesenteric vein, which drain nutrient-rich blood from the small intestine, and also a splenic vein. It's a combination of these two veins, okay? Superior mesenteric vein and also the splenic. Okay, so that is how the hepatic portal vein is being formed. Okay, splenic vein is enlarged because of the conversion of the following three tributaries. Okay, if you see here, the splenic vein is enlarged because of it is become a conversion of the three tributaries from the inferior mesenteric vein, okay, from the pancreatic vein from the pancreas, okay, and also from the left gastroepiploid vein, okay, from the stomach. Okay, this is the left gastroepiploid vein, okay, from the stomach. Okay, in terms of clinically, so you need to know how to measure blood pressure. Okay, blood pressure actually is being what actually we measure from the blood pressure. Okay, the force that exerted by the blood against the inner wall of the vessel through which it flows. Whenever the blood is passing through the vessel, it creates a pressure. Okay, creating a force. So the arterial blood pressure can be measured by using a device here. This device is known as a sphygmomanometer. And most commonly, the cuff will be wrapped around the upper arm, and we put a stethoscope here. Okay, at the over the brachial artery. Okay, we put the stethoscope over the brachial artery, and we compress it against the humerus. Whenever the blood pulsates, whenever the blood pulsating through the constricted brachial artery, the blood pressure will produce, and it indicated by the sphygmomanometer. Thank you. I hope you enjoy with the teaching.